Good afternoon, and a warm welcome back to the Refreshing Point. I will be sharing with you how the sense of smell serves as a guide to your health. A study from Florida State University found that an unhealthy, high-fat diet also causes impairment in the olfactory system or the sense of smell. The study established an association between consumption of high-fat foods with changes in neuronal proliferation and the normal apoptotic cycle, which impacts olfactory perception. It is known that high-fat foods increase the risk of contracting cardiovascular diseases and diabetes, as well as other chronic illnesses. In this study, laboratory mice were fed a high-fat daily diet over a 6-month period and were taught to associate an odor with a reward, water. Data collected showed that the group of mice that had a high-fat diet were slower to learn the association than other mice that were fed a normal diet. When a new odor was introduced, the high-fat diet mice group could not adapt easily. It was found that the mice who had daily high-fat diets had a reduction in smell capabilities because 50% of the neurons responsible for the functions of the olfactory system were non-functional when decoding odor signals. This study did not include any human tests, and there may be a significant difference in results. It is also important to note that the test done on mice included a high-fat diet and not a high-sugar one. There is a difference between resulting obesity from high-fat diets compared to obesity from high-sugar diets, and the consequences of the olfactory system may not be the same. Other related studies include how the olfactory system affects our preference for what we ingest, and problems with the olfactory system result to unhealthy food choices. A separate study warns that people who have problems with their sense of smell may be at increased risk for dying sooner than those who don't have trouble smelling. Researchers analyzed information from more than 1,100 adults in New York City, whose average age was 80. The participants took a scratch and sniff test, in which they attempted to identify 40 common odors. People who scored less than 18 points out of 40 were said to have an inability to smell. Loss of sense of smell was a stronger predictor of death than even a diagnosis of cancer, heart failure, or lung disease. The study found that the people with scores in the low range, 0 to 20 points, were nearly 4 times more likely to die over a 4-year period than those with scores in the high range, 31 to 40 points. About 45% of participants with scores in the low range died during the study period, compared with 18% of those with scores in the high range. Becoming aware of the scents around you can help increase your sense of smell, especially if it is done regularly. Make a point to smell your food before you eat it, and notice the scent of flowers or even rain. You can also choose 3 or 4 different scents, such as floral, fruity, and coffee. Sniff them 4 to 6 times a day. This may help the different receptors in your nose to work better. As always, thank you for watching. Good day and good health.